Hi, this is Dr.Saxena, and I've been talking about what exactly, how to optimize your health, and the main concerns or the kind of stuff what we are trying to work it out is trying to maintain a good health. It's not just health is not just absence of the disease, and we have been talking upon what are the other things, how we can optimize our health. Let me give you some different perspective from where we are trying to work it out. I absolutely agree that the modern medicine and particularly when it comes to the acute medical care, this is perfect things what we are getting. If we are getting acute appendicitis, if we are getting a kind of cesarean injection, all your orthopedic procedures and all that, we are getting a fantastic outcomes and all. What is happening beyond that, what is happening to the people who are suffering from chronic diseases? And now that we see chronic diseases in a big surprise, which surprises us. Yesterday I was talking to one of the parent who was telling me the child at age 11 years got ankylosing spondylitis. Similarly, people are getting juvenile rheumatoid arthritis, people are getting into things which with our background, what we used to learn, what we learned during our medical career, is all these things we thought it was a late onset disease and all that. We are getting insulin dependent diabetes at the age of 3 now, and we have to really introspect what exactly we have been, what is the rise of, why there is such a increased numbers of people into chronic diseases. When I talk about chronic disease, I will try to work out here only with the autoimmune diseases. It includes allergies, asthma, ADHD, autism, arthritis. You have got all these things we try to cover it out. Crohn's disease, this kind of stuff. So we need to take a step back, try to understand where what happened. So the one thing which comes to my mind is there is a thing called some problems which occur quite late after, and you don't recognize. This is probably one of the things. We are good at preventing infections, and we had it is I can always have talked. I always talk about some stuff called a thing called vaccine. Vaccines were heralded as one of the 20th century's greatest medical achievements. Child vaccinations have become society's indispensable weapon now. So what? See, it is basically defined that contagious disease. So what happens is we are trying to understand why there is so much increase in insulin dependent diabetes, why there is so much increase in autism, why there are people are suffering so much from allergies and all. So I'd like to review here. This is one thing which we need to look at that. So are these vaccines responsible, number one, for this long-term side effects, number one? And other thing, what we need to work it out is is there any things we are missing? What are the see, according to the Metropolitan Life Insurance Company, which was okay, the records of this from 1911 to 1935, there were the 4 leading causes of infant deaths, childhood deaths, were from infectious diseases in the US. That is namely diphtheria, pertussis, which is whooping cough, scarlet fever, and measles. These are the 4 main. So this was statistics in 1911 to 1935. However, by 1945, the combined death rates from these causes declined by 95%. Much before than the implementation of the mass vaccination programs, mass immunization programs. By far the greatest factors in this decline were sanitation through public health measures. Number 2 was improved nutrition. Third was better housing with less crowded conditions. And the 4th one was introduction of antibiotics. Diphtheria, whooping cough, pertussis, this was the dreaded kind of stuff. But with the introduction of antibiotics and this particular things, we know we can always control that particular thing. So I just want to work on something like this. Introduction of vaccines has accomplished more than what we could have dreamed. And see, again, we need to understand, but because of each act of administering that small bits of disease and foreign substances which were added into that, into children, opens the door to the possibility of debilitating consequences. Ensuring that we need to look at that the vaccine and those in the future should be as safe as possible. This has been worked, debated for decades about pro and anti. I don't want to join any kind of pro, but I want to see that whatever vaccines we are getting, the safe vaccines, they are peer reviewed. It is not brought in the haste. You need at least 3 years downtime to understand what is the nature of the vaccine. So big things. It's a proven eradication of disease with coincidental findings following changes in the society, like better nutrition, better sanitation, and all. Other things which we would like to put you across is the mortality curve for many diseases spiraled down before the introduction of vaccines. So whatever the assumptions were, the one assumption was vaccine was safe, vaccines are effective, and vaccines are giving lasting immunity. What are the flaws in this theory of immunization? See, we believe it is the microorganisms rather than the overall health of the host are responsible for the disease. Number one flaw. And the number two, it ignores many instances where fully vaccinated individuals have nevertheless contracted the disease. Third one is, it doesn't take into account that vaccines may only work in hit and miss fashion, conferring temporary immunity, the length of which no one understands. It doesn't take into account the large numbers of people who had illness like diphtheria, but they don't produce measurable antibodies. It doesn't ask what happens to live viruses over time. Numerous studies suggest that they consume large portions of immune systems, eventually causing autoimmune diseases. So this were the kind of things, the questions which prop up because of this particular thing called immunization. And where are the studies? Studies were not designed to assess serious rare adverse reaction. Even now, we try to check for a patient for half an hour, like to look at acute problems. If any acute problems occur, they should occur within immediately. Anaphylaxis can occur immediately, but sometimes it can take delayed also. So we are only checking the acute problems. We are not bothered what is happening to this patient after 3 years. The total number of recipients is too small to follow up generally, too short to detect. See, you have given the window period of half an hour or sometimes 1 day or something like that. It's too small. You need to look at the consequences of later thing also. This is what I was trying to tell. It is pre-licensing trials. Researchers typically observe the study participants for hours or several days to note these adverse reactions, like fever or something like that. But what I want to tell you is, it's the delayed autoimmune responses were not taken into consideration, which may take months or years. Vaccines were labeled safe as these autoimmune reactions were rarely seen during this early period. Now we see people getting into brittle diabetes after a month or something like that of vaccination. So what about, what is this autoimmune disease I'm talking about? Autoimmune diseases are those in which the immune system mistakenly identifies a good healthy substance as a bad or harmful one. The result is that the body begins to produce antibodies which then attack joints, muscles, nerves, and specific tissues. With all said and done, despite all the advances in medicine and the medical technology, we are seeing an increase in numbers we are seeing the increase in numbers of juvenile rheumatoid arthritis, juvenile diabetes, pediatric asthma. You name so many things. So, what is the reason for this autoimmune disease suddenly occupying a center stage? We see a lot of people who are having autoimmune disease. Is it the mass vaccination, a mass immunization of the children supposed to change or damage their young developing immune systems? Because we don't see robust immune system nowadays. With the kind of sugar what we take, the diet what we take, the kind of antibiotics what we take, the kind of immunization, your immune system is never developed. The robust immune system which can fight any disease, now it's a rarity. The children are injected with foreign disease causing substances before their immune systems are mature to tackle. Talking about giving something at birth, 3 day, 6 weeks or 3 months after birth. Absolutely. And there is another facet is the multiple simultaneous vaccines may cause reactions, not single vaccine. I can go on and on like that, but somewhere I just want to tell you there is a thing called mucosal immunity. If you try to work out with the mucosal immunity, this is a fantastic thing. And if you disrupt this mucosal immunity, this is a mucosal barrier. If something goes through the oral and gets you get some antibodies, this is a perfect thing. And if someone putting a jab directly into the muscle and into the bypassing this mucosal barrier, so as a result, mucosal immunity doesn't develop, and if it doesn't develop, remains relatively weak and stunted in many children, causing complications which can be of which we now believe it is a rapid increase in asthma, eczemas, and what we see these days. Rising allergies are phenomenal. There was a study in UK. This rise in allergic disease among children in UK over the past 30 years remained unexplained. You have to see, the one hypothesis is that the infections in early childhood prevent allergic sensitization, and that successive generations of children have lost this protection as their exposure to infectious diseases in early life has declined. Consequently, the prevalence of atopy and concomitant allergic diseases are on the rise. So, somewhere I think we need that introspection. With disrupting an immune system, if a person has a tendency towards a disease at a certain age, a vaccine might make more susceptible later. I have reasons. This is one of the paper in 1997 by Dr. Weiner, immunologist. He has suggested chickenpox vaccine given at children forces the disease to emerge in adolescence when it causes more serious complications than it can during childhood. So, where are we leading into that? We have to see that, yes, this orthodox kind of things which are trying to, instead of creating this mucosal immunity, trying to make it something, we are not against. We are talking about the contents which are there in the vaccines, which is causing a more problem, like thimerosal, like aluminum, like polyethylene glycol, like a lot of stuffs. So this is causing a major problem, and it's a kind of I think it's a big thing because of this pandemic now, and we need to really introspect and check out how we can work it out.